Erectile dysfunction, impotence. This is the inability to develop or maintain an erection. During erection, the individual undergoes a series of sexual response stages. That's the sexual response cycle that starts with excitement, plateau, orgasm, and resolution. When you have a graph of arousal against time, it always starts with excitement. This involves muscle tension, heart rate, and blood flow to the genitals increase to cause an erection. Plateau, this is the maximum level of excitement. Orgasm, the accumulated sexual excitement is released during orgasm to cause ejaculation in males. Resolution, the body returns to its original unexcited state. Welcome to SR Medicine. Don't forget to subscribe. Hit the notification button, like, share. Let us go through the structure of the penis. Understand erectile dysfunction. Urethra, we have the corpora cavernosa. This surrounds the corpus spongiosum. The corpora cavernosa is made up of the erectile tissue, which is filled with blood to cause erection. Blood supply to the penis, there is the common penile artery, bulbar artery, cavernosal artery, circumflex artery, the dorsal artery, and urethral artery. Going through the section of the penis, there are superficial and deep dorsal veins. These drain blood from the penis. Dorsal artery and now corpus cavernosa, cavernosal artery. This supplies blood to the corpus cavernosa, which is the erectile tissue. The urethra, corpus spongiosum, tunica albuginea. The corpora cavernosa is made up of blood-filled spaces known as cavernosal spaces. These spaces are aligned by endothelial cells surrounded by smooth muscle. We are going to look at the role of endothelial cell and also the smooth muscle cell. These smooth muscle cells, they do relax. When they relax, the cavernous spaces are filled with blood. When they are filled with the blood, this causes erection. And also, whenever they are filled with the blood, the corpora cavernosa pushes against the vein that should drain blood from the penis. Therefore, these two cause erection. Deep artery that provides blood to small arteries to supply blood to cavernosal spaces also there. Now, innervation of the penis. The cavernous nerve innervates the penis. It has the somatic nerve and the autonomic nerve. These both innervate the spongiosum, the corpus spongiosum, and the corpora cavernosa. Erection is caused by parasympathetic fiber. Then ejaculation is caused by sympathetic fibers. Take note of that. Stimulation of erection, it may be physical, reflex action, or it may be emotionally stimulated by thought called psychogenic erection. Parasympathetic nerve fiber that cause erection, it releases acetylcholine. This moves and binds to muscarinic receptors on endothelial cells in the cavernosal spaces. We've seen the endothelial cells that do line the cavernosal spaces. The acetylcholine binds to the muscarinic receptors on these cells. This activates nitric oxide synthase. Enzyme converts the amino acid arginine to citrulline and also nitric oxide. This nitric oxide then diffuses into the smooth muscle cell that surrounds the cavernosal space. When the nitric oxide diffuses into this cell, it also activates the enzyme guanylate cyclase. This converts GTP to cGMP. This cGMP that causes a fall in calcium levels to cause relaxation of the smooth muscles. When the smooth muscles relax, the tissue gets filled up with blood and it increases in size. Erection. Relaxation of smooth muscles allows the cavernosal spaces to expand and become filled with blood. Also, the corpora cavernosa grows in size. I told you that it compresses the veins, making it harder for blood to leave the erectile tissue. Something like that. When the corpora cavernosa enlarges, it compresses those veins. Therefore, blood drainage is prevented. This maintains an erection. More blood comes in and little is drained. Causes of erectile dysfunction. Let us dive into the causes. Psychological stress performance anxiety and depression, relationship difficulties and sexual boredom or disinterest. Physiological causes: inadequate blood supply. It may be caused by atherosclerosis. This causes hardening of blood vessels supplying the penis, making dilation of blood vessels very hard. Blood vessels may be damaged from hypertension. Hypertension can cause wear and tear of endothelial cells, decreasing the ability to provide nitric oxide. Diabetes mellitus. High glucose may cause hyaline atherosclerosis in small arterioles in the penis. The arterial walls may develop the hyaline depots, making dilation harder. Hyaline also builds up in the basement membrane, causing it to thicken, making it harder for oxygen to move from arterioles to the tissue. This causes hypoxia and death of the smooth muscle cells we've seen. Hypoxia may also cause the parasympathetic nerve fibers to die. Therefore, no acetylcholine, no nitric oxide synthase, and therefore there is no nitric oxide which is released. Stroke, multiple sclerosis, back or pelvic trauma, damaged nerves leading to erectile dysfunction. Endocrine dysfunction that may cause low levels of testosterone like hypogonadism. Low testosterone means that low levels of nitric oxide synthase. And what we should know that testosterone decreases with age. That's why the risk of erectile dysfunction also increases with age. Medications may also cause erectile dysfunction like diuretics. These ones, they cause less fluid saturation. Antidepressants like methadone, antihypertensives, high blood pressure drugs. Watch my video on antihypertensives, prostate cancer drugs, anti-seizure medications, Parkinson's disease drug, antiarrhythmics. These are drugs for irregular heart action, tranquilizers, muscle relaxants, histamine H2 receptor antagonists, hormonal medications, chemotherapy medications. Then drug abuse. Drugs which may be abused here may include alcohol, amphetamines, barbiturates, cocaine, marijuana, methadone, nicotine, and also opiates. Diagnosis of erectile dysfunction are sexual experiences of the individual, examination of psychological stressors, blood tests. Here they may test for testosterone and glucose levels, neurological assessments, duplex sound to evaluate blood flow may also be diagnosed, complete blood counting, liver and kidney function tests, lipid profile to measure lipid levels like cholesterol. High levels may indicate atherosclerosis, that's hardening of the arteries, which can affect blood saturation in the penis. Thyroid function test, bulbocavernous reflex. This evaluates nerve sensation in the penis. During the test, the head of the penis is squeezed to cause the contraction of the anus. If nerve function is abnormal, there is a delay in the response time. Treatment: address the underlying cause. PDE5 inhibitors like sildenafil inhibits the PDE5 enzyme in endothelial cells. Therefore, there is no breakdown of cGMP. And what we know that the high levels of cGMP more smooth muscle relaxation to cause erection. Vacuum erection devices. These apply negative pressure around the penis to help draw blood into the penis. Prosthetic implants in the penis to make it rigid. Thank you for watching. Don't forget to subscribe, notification button, like, share. Thank you.